Yeah, start recording and then live. And when you're live, I will start talking to this camera here. Boy, I'm really short on that.
You're way down there.
I'm way down there. So thanks for joining us. We have our first live procedure video. Second attempt. No, we didn't actually do the whole procedure. We were about to do the procedure, found out we weren't streaming live so that you guys could see us while we're doing it. We know that now. We have it set up so you guys can be a part of this. And go ahead and start commenting. We actually have somebody reading comments to us. Not all of them, but some of the comments. So certainly all the super chats get through. Mark, you've been on videos before, right?
Yes.
Okay. So we're going to look at this thing on his back that's been there for
3 weeks.
3 weeks, and it was there for about a week before Aini started following it, watching it, and it grew really rapidly.
Right. It changed in size,
So,
color, and shape.
See, it's all three. You remember your ABCDEs.
Yes.
Evolving in size, color, shape. So can we take a look at it by having you lie on your stomach for now? Or, well, actually just, there we see it.
Yeah.
Yeah, that's fine. So Mark has these growths, seborrheic keratoses or skin tags. And this one here is the one we're talking about that Aini noticed it, his wife noticed it after it had been there for about a week, or Mark knew it was there for about a week, and then she followed it for a couple of weeks and saw that it grew really big, and it's red and irritated. Probably just an inflamed seborrheic keratosis, but we're going to find out for sure. We're going to go ahead and biopsy it now with a shave biopsy. Mark, can I have you lie on your side? Like, yeah, that'll work. Well, let's put a chucks underneath you. Let me find I'll throw one on there. So can I have you get up just enough so I can put something underneath you in case there's a little drop of blood that makes its way down. And some of you may know Mark and Aini from previous videos because they've both had skin things done.
Yes.
In fact, oh, Mark was the one that did the Dr. Trauner video.
Yes, he did.
Yeah, if you guys have seen our Dr. Trauner video with the series. So I'll go ahead and do the prep with some Hibiclens and some. Now one thing, I'm going to do a little bit of directing here, even though I'm not really the director. One thing you can do is when we go to something else, going wide and then zooming in, it can keep focus a little bit better. So if you wanted to catch what I was doing here, get in on this, because that's only getting the wide shot over here. Yeah. Just doing a wide shot, it'll focus fine. Okay, let me get some gloves for that. Do we have any comments?
Nothing yet.
No. Nothing yet. No comment. Go ahead and make your comments, super chats, whatever. All right. So this is Hibiclens. The purpose of this is to kill any bacteria living around this, and I'm kind of going around because this is pedunculated, meaning it's smaller at the base where it contacts the skin than it is up here. It comes down as it attacks, mushroom shaped, I guess you could call it. I'm going to put some more on that. All right, so we do 3 of them, and we do these concentric circles from the inside outward. All right. So even though there's no comments yet, you guys confirmed that, yes, indeed, we actually are going out live on YouTube, right? Mm-hmm. Okay.
We have a few viewers.
Yeah. Well, it's not our usual time, and I haven't announced it ahead of time. It's so new. It's still experimental.
Oh, you got a hello from somebody.
Oh, what's the name? Or can you tell? J. Lafee. Thank you. All right, here we go with the shot. And Catherine, thank you for commenting. Here we go, Mark. Sharp. Getting under it. Giving the injection. Getting under it more.
Nationwide, huh?
International.
Yeah.
I'm putting my gloves on now. Sterile gloves. Size 7 in case you're interested. People aren't in medicine or a field where you use sterile gloves wouldn't know that the sterile gloves actually come in, there's sizes for them, kind of like shoe sizes. So no comments about man with small hands. I'm not running for president. I don't know if the Europeans will get that joke. Our friends in France and Germany, tell us if you get that joke, if you know what I'm referring to there. I think they can figure it out. Okay. So do a little test. Mark, does it hurt for me to do this?
No, I can feel it.
And you'd expect that that would hurt because these are sharp little things here. Adsons have teeth, Adson forceps. So I can pull this thing up with these. They're wonderful. I can shave this off. The reason we're shaving it off is just to make sure that it's not cancerous. I don't think it is, but boy, did it grow rapidly. And that goes in there. Put the sharp things over there. Yeah, there is a drop of blood. So now, we're getting close to the point where I'm going to have you roll over on your side, Mark,
Okay.
or on your stomach. But very carefully, because there's a specimen container right next to your left shoulder. So if you move your left shoulder, there, that's enough. That'll work. Thanks. Ian, the camera operator / medical assistant, got it for us. Now, how do you want to do you want to just put the camera over there?
I've got some right here. I could probably.
You just do it with one hand? Okay. So Warren, let me get the sterile tray out from in front of you. Put it over there. I don't need this anymore. Okay. So wound seal is this wonderful powder that helps to stop the bleeding and to seal the wound, as its name implies. So there's an angle here. You all right with that?
Yeah.
You want me to get more flat?
No, it should be all right.
Let me just try. Mark, are you able to get any more flat just for a second?
Okay.
I'm sorry, 1 minute.
All right.
Go ahead and lay your right shoulder down more if you can. Because the flatter the surface, the better. I'm going to pull your skin up. Isn't that neat? Skin moves. Okay. Can you see it?
I see it there, yeah.
All right. I'll give you as much view as you need. You tell me when you're ready.
Okay, I'm all set.
3, 2, 1. Somebody give me a minute. So I'm putting on pressure for a full minute with my finger in the sterile glove. And then after a minute, I'll take it off, and what we'll find, actually this would be a good time for questions if there's any questions, because we're just pushing pressure on it for a full minute.
Someone said this is very inspiring.
Inspiring. Well, thank you. Who said that?
It was from Germany. A BooBoo from Germany.
A BooBoo from Germany. Thank you. That's a very nice thing to say. We appreciate that.
Catherine asked what the powder is.
The powder is Wound Seal. It's a commercial product that polymerizes when it comes in contact with the blood and creates a barrier that keeps the blood from coming out, keeps bad stuff from getting in, like bacteria when he leaves here. So it really functions as a natural scab would if he formed a scab over the following 12 hours plus.
And that's over a minute.
Okay, that's over a minute. We're going to take this off, and this is the moment of truth. We see, oh, there's just a little tiny dot of blood. When it works perfectly, you don't even have that. Let me just dab it and kind of move the wound seal over it. There's one down there too. How's that doing? It's still coming. So what we'll do is we'll just put a Band-Aid over that. It's certainly much less bleeding than it would have been without the wound seal. Let me put some things in the red bag here. And oh, I guess one thing I can show is you can see where the bleeding had been when I put my finger down. This is going to be hard to clean up because the wound seal got... So I'm just brushing it, not like it's a sterile area anymore because it's not. And I'm going to put a Band-Aid on that. So let me...
Someone asked hemostatic powder, like aluminum.
It's not aluminum. I once read it, but it's not aluminum. There are some other things that work somewhat similarly for stopping bleeding. This stuff, a lot of people ask about the use of this stuff and they think they could just put it on cuts at home. And I don't recommend that at all. It stings terribly if you're not numb. Okay, Mark, can I have you sit upright? There we go. Put that in the red bag also.
You're gonna clean up his armpit so he doesn't get the blood on his white t-shirt, right?
Absolutely.
Thank you.
Show it to us. Well, did you see if... Yeah, let me get that for you. There's a little bit of color to it, so let me just get that, just to make sure. And
What, Mark?
Huh?
What'd you say?
It stings now.
It stinks.
you feel the stinging?
Yeah.
Yeah, that stuff will sting. It shouldn't be stinging you because you should be numb, but even you're feeling it, huh? So let me get some of that. Did I have any? I can just use paper towel just to get the blood off of his armpit there. And we're open for questions either from Mark or Aini or friends watching live.
So what happened now? You think it was just a growth? It wasn't a problem?
In case you guys couldn't hear, Mark was asking what happens next. Do we just think it was growth and not going to be a problem? I think it was a seborrheic keratosis, which these are kind of that here on your other places on your skin. They're benign growths, don't cause any problem, but we'll make sure, we'll tell you by the end of the week, certainly. You know what? Blood got up in here.
Well, I'm just a bloody person, huh?
No, you're good. Okay, now you're ready to put your shirt on.
You want it?
And then, were there any other questions?
Yeah, it itched and then I would lean against it or rub against it or something.
That's how it started?
It bothered me, you know.
Well, he often in the summertime gets, I was telling Ian, he gets these little like sweat, little boil up, you know, like the babies get,
Yeah,
the little things.
but
around
this
their
was
nose.
different somehow.
Well, because it started growing.
Okay.
Yeah, it changed.
All right.
I never could see it.
No, because it was on your back. Well, I guess in a mirror maybe you could.
I could feel it, you know,
Yeah.
it would itch.
Okay.
And then when
I'm really short.
against it or something,
Let me come up next to you.
leaning against it, you know, you could feel it would just kind of hurt a little bit. It wasn't painful or anything, but it would hurt.
Okay.
And it bothered me. I didn't know what it was.
Well, at least that's gone. You know, if nothing else, if it was benign, we did this for a reason. Got rid of this annoying growth.
Mm-hmm. Yeah.
All right. So let me go ahead and say goodbye to our viewers all over the world, apparently, and people who watch this afterwards, who see the video after it gets posted. You can go ahead and comment in the comments. This is experimental, doing the live procedures. We hope to get more of a regular time at some point. We still intend to do the twice-a-week procedures on Tuesday and Friday afternoons at 4. It'd be kind of neat if we could make this correlate with that, maybe have the Tuesday one be our live one. We'll work toward that in the future, but for now, it's still a little experimental, so please do give us your comments. And Mark, you give us your feedback on what it was like to be a patient going through it.
Oh, you're good.
It-
You're easy to be patient with.
Easy to be patient with. You might enjoy looking at the comments too. Please do in the comments wish Mark well as he recovers from this. It won't be much recovery, but it's
No.
nice to have nice things written.
Yeah.
So until next time, Mark and the whole team here, the whole live video team, all telling you to stay in good health.
Yeah.